Unit 1. Introduction to Health and Illness. Maslow's Hierarchy of Needs Theory. Introduction. Abraham Harold Maslow, an American psychologist, was born in New York in 1908. He introduced the hierarchy of needs theory in 1943 in his paper A Theory of Human Motivation. This theory plays a foundational role in understanding human motivation and behavior. Maslow proposed that human needs are arranged in a hierarchical order, from the most basic to the highest level of personal development. According to him, basic human needs must be met before individuals can focus on higher level needs. In the context of nursing, it is an essential framework for assessing patient needs and prioritizing care. Levels of Maslow's hierarchy. Maslow's theory consists of 5 levels of needs. Level 1, Physiological needs. Foundation of the hierarchy, essential for basic survival. These are biological and physical requirements that every human needs to sustain life. If these needs are not met, the human body cannot function properly, and higher level needs become irrelevant. Components. Oxygen, vital for all body cells. Deprivation can lead to brain damage or death within minutes. Nursing intervention, monitor respiratory rate, oxygen saturation, use of supplemental oxygen, assess breath sounds and signs of cyanosis. Water, essential for cell function, temperature regulation, and waste removal. Dehydration affects electrolyte balance, blood pressure, and kidney function. Nursing intervention, maintain IO chart, assess for dehydration or fluid overload, check skin turgor, monitor daily weight. Food, required for energy, growth, healing, and immune function. Malnutrition weakens the body's defenses and delays recovery. Nursing intervention, monitor weight, appetite, lab tests, albumin, electrolytes, assist in feeding, provide dietary modifications. Physical activity, rest, and sleep. Physical activity depends on the intact and functions of neuromuscular and skeletal system. Rest and sleep allow time for the body to heal and essential for mental clarity, emotional stability, and physical energy. Nursing intervention, assess sleep patterns, provide a quiet environment, minimize interruptions at night. Elimination, regular bowel and bladder functions are necessary for comfort and homeostasis. Nursing intervention, monitor bowel and bladder habits, assess for constipation, incontinence, or urinary retention. Shelter, ensures safety from weather, predators, and disease, also provides a place of rest. Nursing intervention, assist homeless or at-risk patients with referrals, assess living conditions, report unsafe situations. Temperature regulation, maintained by homeostatic mechanisms. Fever or hypothermia affects metabolism and immune response. Nursing intervention, monitor vital signs, use cooling/warming blankets, educate on temperature management. Sexual activity, important for emotional and relational health, not just reproduction. Nursing intervention, encourage open communication, respect privacy, provide education if needed. Level 2. Safety and security needs. Once physiological needs are met, the focus shifts to protection and stability. These needs ensure physical protection and emotional stability. People need to feel safe from harm, both in their environment and within their personal interactions. Components. Physical safety, protection from injuries, infection, and environmental hazards. Nursing intervention, implement fall precautions, maintain sterile technique, ensure safe medication administration. Emotional security, freedom from fear, anxiety, and emotional distress. Nursing intervention, offer reassurance, listen empathetically, involve patients in care decisions, create a supportive environment. Economic safety, job security, income for meeting basic needs. Nursing intervention, refer patients to social workers or financial assistance services. Level 3, love and belonging needs. Social connection, relationships, and affection. Humans are inherently social beings. After ensuring physical and safety needs, individuals seek affection, belongingness, and interpersonal relationships. Components. Friendship and family bonds. Patients need love, empathy, and social interactions. Nursing intervention. Encourage family visits, support relationships, provide emotional support, use therapeutic communication. Group identity. Feeling part of a group or community. Nursing intervention. Facilitate group therapy or community programs, involve religious or cultural groups if appropriate. Consequences of unmet needs. Lack of love and belonging can result in loneliness, depression, anxiety, social withdrawal, and loss of motivation, negatively impacting recovery. Nursing interventions. Encourage visits from loved ones or arrange virtual contact. Build therapeutic nurse-patient relationships. Show empathy, listen actively, and foster trust. Respect cultural, spiritual, and relationship preferences. Level 4, Self-esteem needs. Confidence, respect, recognition, and personal value. These needs relate to a person's self-respect and how they are valued by others. When individuals feel competent, respected, and confident, they have high self-esteem. Components. Self-esteem, pride, confidence, competence, independence, and personal achievement. Nursing intervention. Encourage independence in ADLS, provide positive feedback, involve patients in goal setting. Esteem from others/respect from others, recognition, appreciation, and respect from peers and caregivers or others. Nursing intervention. Respect patient choices, protect dignity, use their preferred name, acknowledge progress. Consequences of low self-esteem. Feelings of worthlessness. Dependence on others. Resistance to care and rehabilitation. Depression, withdrawal, or aggression. Low self-esteem can lead to non-compliance, apathy, or depression, affecting recovery and motivation. Nursing focus. Encourage independence in daily activities. Provide positive feedback and celebrate small achievements. Involve patients in decision-making. Address changes in body image sensitively, example amputations, disfigurement. Promote dignity and respect in all interactions. Level 5, Self-actualization needs. Personal growth, purpose, and achieving one's full potential. This is the highest level in Maslow's hierarchy. It reflects the desire to grow, learn, create, and become the best version of oneself. Components/characteristics of self-actualized person. Strong moral/ethical standards. Creativity and innovation. Acceptance of self and others. Purpose and meaning in life. Autonomous and self-directed. Lifelong learners, emotionally resilient. Nursing interventions. Support patient autonomy, personal goals, and informed decision-making. Encourage creative or spiritual pursuits, example art, music, prayer. Respect individuality, uniqueness, personal values, beliefs, and passions. Provide opportunities for education and self-expression. Help patients develop coping strategies and life purpose, especially in chronic illness or terminal care. Encourage hobbies, spiritual growth, career, or educational goals. Application of Maslow's theory in nursing process. Maslow's theory can be directly applied to nursing process, assessment, planning, implementation, and evaluation. Nursing process. Application of Maslow's hierarchy. Assessment. Identify unmet needs across all levels. Prioritize urgent physiological issues. Diagnosis. Use unmet needs to form nursing diagnoses, example impaired gas exchange, social isolation, low self-esteem. Planning. Set goals beginning with basic needs, then gradually address higher needs. Implementation. Deliver interventions to meet each level of need appropriately. Evaluation. Monitor if needs are being met and reassess patient status regularly. Additional notes. Maslow's theory in chronic or palliative care. In terminal illness, patients may prioritize love, dignity, and purpose over physiological needs. Focus may shift based on quality of life rather than cure. Emotional and spiritual care become critical for self-esteem and self-actualization. Case study, Mr. Ramesh, a 68-year-old male with chronic obstructive pulmonary disease, COPD. Background. Mr. Ramesh is admitted to the medical ward with complaints of shortness of breath, persistent cough, fatigue, and chest tightness. He lives alone, is widowed, and has 2 sons who work in another city. He has a history of smoking and is now oxygen dependent. Application of Maslow's hierarchy of needs in nursing care plan. 1. Physiological needs, Level 1, Basic survival needs. Assessment, Mr. Ramesh is struggling to breathe, has poor appetite, and is underweight. Nursing interventions. Administer oxygen therapy as prescribed. Monitor oxygen saturation and vital signs regularly. Provide small, frequent, high-calorie meals. Ensure adequate hydration. Assist with activities of daily living, ADLS, due to fatigue. Goal, to ensure adequate oxygenation, nutrition, rest, and elimination. 2. Safety and security needs, Level 2. Assessment, Mr. Ramesh appears anxious about his health condition and the risk of suffocation during sleep. Nursing interventions. Keep call bell within reach and reassure presence of healthcare providers. Educate him on breathing techniques and safe use of oxygen. Prevent falls by maintaining a clutter-free environment. Regularly inspect oxygen tubing to prevent fire hazards. Goal, to reduce anxiety and prevent injury or complications. 3. Love and belonging needs, Level 3. Assessment, Mr. Ramesh expresses loneliness and misses his family. Nursing interventions. Encourage phone or video calls with family members. Facilitate regular visits if possible. Involve Mr. Ramesh in group activities or social interactions with other patients, if stable. Provide emotional support and listen actively to his concerns. Goal, to decrease feelings of isolation and promote emotional well-being. 4. Self-esteem needs, Level 4. Assessment, Mr. Ramesh feels like a burden and lacks confidence in his ability to recover. Nursing interventions. Encourage him to participate in his own care decisions, example selecting meals or clothes. Acknowledge and praise his efforts, even small ones, example sitting up independently. Provide positive reinforcement and respectful care. Goal, to enhance his confidence and self-worth. 5. Self-actualization needs, Level 5. Assessment, Mr. Ramesh expresses interest in mentoring younger patients to quit smoking. Nursing interventions. Facilitate opportunities for him to share his experience. Support spiritual or religious practices as per his belief. Encourage engagement in hobbies or reading material. Goal, to help him feel a sense of purpose and fulfillment despite his illness. Conclusion. Maslow's hierarchy of needs is a foundational theory that provides a valuable framework for nurses to prioritize care, understand human behavior, and deliver holistic care. It emphasizes that health is not just physical, but also emotional, social, and psychological. Nurses play a key role in helping patients meet these needs in all dimensions to promote healing, well-being, and personal growth.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.